welcome to Fostering Global Collaborations to Solve Kawasaki Disease. I'm so glad to have all of you join us today. Originally, I was going to say good afternoon, but I realized we have people from all over different time zones. So it's good morning, good afternoon, good evening, good night, depending on where you are. As I mentioned earlier, my name is Karen Lynn, and I'm the Vice Chair at Kawasaki Disease Canada. And I'm actually going to pass it over to Vanessa to introduce herself. So Vanessa, if you want to unmute and introduce yourself, that'd be great.
Thank you, Karen. My name is Vanessa Gutierrez, and I am with the Kawasaki Disease Foundation, US. I am the president of the organization. I don't want to take too much time because I know we're starting a little bit later. I just want to thank Karen for leading the effort to organize this event. This is one of the first collaborations we have with KD Canada for a webinar, so we're very excited to be able to be a part of this. And I also want to thank Dr. Tremoulet and Dr. Dahdah for their time and effort for this, this event. And I'll pass it back to Karen to start off. Thank you.
Okay, perfect. So I went through a few housekeeping things earlier, but I'll just repeat it for those that might have missed it, just so that you know quickly that we're doing a Zoom meeting today. It's not really a webinar. So that means we can see you and you can see us, but we ask that you remain on mute to avoid disruption of the speakers. We will have a Q&A towards the end. So if you have questions, please put them in the chat and we'll try to get to as many of them as we can. And that we are also recording the session. So it will be up on our YouTube channel later in case you aren't able to stay for all of it or you want to share it with other people that weren't able to join us today. We will also provide that link later on. So I want to get started first by I'm honored to introduce to you, there are two guest speakers today, Dr. Tremoulet and Dr. Dahdah, and they are both co-presidents of the 14th International Kawasaki Disease Symposium that is happening August 26th to 29th this year in Montreal, Canada. So we're very excited. First time it's ever being hosted in Canada. So that's very exciting for us. And so let me get started by first introducing Dr. Tremoulet. She is the Associate Professor in the Division of Host Microbe Systems and Therapeutics in the Department of Pediatrics at University of California, San Diego, and the Associate Director of the Kawasaki Disease Research Center. In this capacity, she cares for nearly 1,300 children with KD in San Diego County and additional 100 children annually hospitalized at Rady Children's Hospital in San Diego. She has a passion for pediatric pharmacology and serves as the co-principal investigator of the NIH-funded UC San Diego Research Program in Developmental Pharmacology, as well as co-director of the UC San Diego Department of Pediatric Clinical Pharmacology Training Program. And next, I want to introduce Dr. Dahdah, who is a pediatric cardiologist at CHU Saint-Justin in Montreal and a professor of pediatrics at the University of Montreal. Dr. Dahdah has an impressive track record in Kawasaki disease research and is a renowned worldwide expert. He is the co-founder of the International Kawasaki Disease Registry, which includes more than 70 medical institutions and universities from around the globe, North America, South America, Europe, and Asia. In early 2021, Dr. Dahdah founded the Kawasaki Arab Initiative, a nonprofit collaborative network of healthcare specialists and researchers who aim to improve health issues caused by Kawasaki disease in the Arab world. So needless to say, we are graced with the presence of Kawasaki disease world greatness for us because these are individuals that have spent many years dedicating their lives to Kawasaki disease research and helping patients. So we are very honored that they took time out of their very busy schedules to come and speak to us today. So thank you, Dr. Dahdah and Dr. Tremoulet for being here with us today. Sorry, I think you're on mute.
Yeah, we're fighting who's gonna talk, who isn't. So it's my absolute honor to be here with you to exchange and taking questions, as well as being the co-president of the conference of IKDS 2021 to take input from families we can address also during the meeting.
Perfect. Oh, sorry, there's one other housekeeping thing. I think if the view you're getting is not speaker view, you might want to, the participants, you can use the view function in the top right corner to change it to speaker view. I'm not sure if it's automatically changed to that, so please do that if you prefer. So I'll pass it over to Dr. Tremoulet and Dr. Dahdah to first talk to us a bit about IKDS.
Yes, absolutely. So the IKDS has a long history for nearly 40 years now. It started in Japan and the US. It really gathered people with passion to worry about and to treat and diagnose and spread the news about Kawasaki disease in an effort to make it affordable and also easily diagnosed. Spreading the knowledge is very important. So this is the 14th session because the meeting takes place every 3 years. The previous session was on webinar from Japan. And the previous one, previously to that one, was also from Japan, but the last one was a webinar due to the pandemic. Hopefully, and luckily enough, we are getting together in 2 months in Montreal. We are addressing not only science, but how science could be managed globally, putting hands together. So the topic of bringing Kawasaki disease to the top priority of all authorities is really important, and collaboration, global collaboration, is a major thing that we try to promote.
Hi, everybody. I'm Audrey Tremoulet from UC San Diego, and it's a pleasure to be here with you and to be co-president with Dr. Dahdah, and to host this meeting in Montreal. I did want to let people know that the meeting will be 3.5 days long from August 26th through 29th. I did put the link in there for registration as well, which is still open. And we have for those that are families affected by KD that are with us today, we have a couple of specific sessions for folks in mind that are families of Kawasaki patients. One is a session where we will have a Meet the Experts for our families that is going to be led by KD Canada, as well as our US-based KD Foundation. And then there will be more of a business meeting amongst the foundations. And the reason that we've taken time out of the meeting that's dedicated to this is because we really feel like there's an incredible importance for advocacy. And for anything to continue in Kawasaki disease, whether it's change is in the treatment, research being funded, all of that really requires all of us to have a voice for KD. And we all have a voice, we just use it differently. So I hope what you'll take away from this today, not only knowing that we're all going to be meeting in person in a couple of months, but to see how you can use your voice to really help spread good information about Kawasaki disease so that we can continue to provide treatment worldwide for these patients. So we invite you to join us in person in Montreal if you can make it. But please know that your local KD Foundation around the globe is there to really serve as a platform to continue to advocate for patients with Kawasaki disease, even between our meetings.
Great, thank you, Dr. Tremoulet and Dr. Dahdah. I don't know if, if people go on the website to register, they can then see a little snippet of, well, not a snippet, it seems to be the schedule of all the topics that are going to be covered. And it's an amazing range of topics. I'm very excited to be attending because I think it covers everything from the etiology all the way down to transition. So the whole spectrum of a lifetime of a Kawasaki disease patient. So I think I really encourage everyone to go on there and take a look and see the exciting things that are going to be presented and the opportunity that we don't always get. I mean, it's every 3 years, and to have it because next year, the next time maybe overseas. So if you're in North America, especially, this is a great opportunity to come and learn and meet some of these amazing researchers and clinicians who I know a lot of parents who do a lot of research online, because Kawasaki's patients, parents are very persistent. So I know that these names, when they see who's speaking, it will resonate with them. Like, oh, I read this person's research. So I encourage everyone to kind of go on there and take a look at it. I don't know if there's anything, Dr. Dahdah, Dr. Tremoulet, that you want to highlight in particular that might be, something that you think, besides those sessions for the parents, if there's something else you want to highlight about the scheduled events for those 3.5 days.
Yeah, I think you mentioned, Karen, the long-term treatment of KD, which I think is incredibly important, and the long-term follow-up. Dr. Dahdah and I wrote a statement for the American Heart Association about transition of care. I think as pediatricians, we do a really good job in taking care of these patients, but then especially for patients with aneurysms, finding them a medical home when those kids are adults can be complicated and difficult. And I think that that's something that we can all advocate for at a local level. For those of us that are providers, we can find the adult counterpart that's interested in KD and educate them about what's happened and how to have information passed correctly. And then for our families, even when your kids are young, starting to ask about, so when my kid grows up, if someone needs to follow them, who is that going to be? And I think having a conversation locally is super important. So I think that's something that we're both very passionate about, Dr. Dahdah and I, and we want to definitely highlight during this meeting.
Yeah, that's wonderful, because I know that's top of mind for a lot of parents, because as the population is getting older, there's a growing number of people that are going into transition. So I know that's a question I get often. So I'm glad that that's going to be covered at the meeting, because I don't know if traditionally in the past that has been as much of a hot topic in the KD world, right? Or if it's an emerging concern. So I appreciate that. Sorry, Dr. Dahdah, I know you want to add something there.
Yeah, absolutely. Adding to this, we mentioned collaboration, which is the thematics of the meeting itself. But it is not only to collaborate with each other, but also to bring in other experts, other knowledge seekers as well, to make it a common knowledge to many people. We're also working, as people have been doing so for the last several years, to bring on this information to emerging countries who are working hard to make their colleagues within their countries, within their regions, knowledgeable of Kawasaki disease. So we need to increase the number of experts. Obviously, we need to improve expertise, but also to increase the number of those who seek knowledge from these experts, and to expand the circle of the science and common sense of how to treat, how to follow Kawasaki disease patients all across.
Which is a great segue, because that was the next thing we wanted to discuss a little bit. I know, given the name of the webinar, about this international collaboration. And, if you want to speak a bit about that, because I know that right now it's a symposium that happens every 3 years, but I know that that's not the vision. The vision is to grow this into something that is an ongoing collaboration. I know you do collaborate as clinicians and researchers. I've seen that. I know they do that in pockets, but I know what you're trying to do is something greater, that not only has the clinicians and the researchers, but also includes the patient, the families, the charities, the advocates. So I don't know if you want to talk a little bit about that, because I know that's also going to be the focus of that last day. There is going to be some discussion on that. So if you want to give, because I know we have people from around the world right now with us, and some of them are part of these charities. So maybe you can give us an idea of what that might look like, or what you envision that to be, and how we can prepare to be part of that.
Yeah, so we are starting the meeting at the very top, day one. We're opening it up with understanding what collaborations currently exist. So we're going to have a panel from around the globe, and have everyone that's been chosen as a panelist there collaborates internationally. And so that's the first thing, is to even know what the landscape looks like from a research perspective. On the end of day 3, the goal is to sort of wrap up the scientific presentations with a summary of where the gaps are. So what is missing in certain parts of the world? What are the hurdles that certain regions of the world have? And in terms of care, in terms of access to medications, things of that nature. And then on day 4, which is a half day, which is the 29th of August, we're really going to focus on hopefully thinking about having a broader society. So having IKDS stand for not only International Kawasaki Disease Symposium, but International Kawasaki Disease Society, which would serve as an umbrella organization not to replace anything that already exists, but to really give people a place to meet. And if you go now live to ikds.org, you'll see the website is up. Needs a lot of work. We're always looking for help with that. If anyone is a webmaster designer out there. But that is a place to meet and a place to host what's going on. And we're hoping to have a broader society where physicians and patients can interact more, where people can gather. There's a lot of great stuff out there, but it's dispersed and it's diffuse. And we're hoping to have, at least at the very beginning, a website, ikds.org, where people can go to. And I will put it in the chat as requested.
That's great. Thank you. So the next segue we were going to do was about the Q&A, but I see Rosella has her hand up. So I was like, may as well let her kick it off with a actual written question, or sorry, spoken question. So Rosella, please unmute yourself and you can.
And thank you, Dr. Dahdah and Dr. Tremoulet. I was just, thank you for all the effort that you do for Kawasaki disease. We are the Kawasaki disease Italy, so we are the family organization. Just to introduce myself, we will be in Montreal the end of August, so we will meet in person again. Just to meet your point regarding the international collaboration, we are working in Italy, and we have spoken with Karen and Vanessa Gutierrez as well about this idea to create an umbrella organization. You explained it very well, actually, that it's not something that has to replace the organization in each countries, that have to stay and have its own goals and fundraising activities and so on. But we truly think that we are at the point of Kawasaki disease history that we need to step up this collaboration at a different level. So we need, to foster this, to take the title of this webinar, to foster this collaboration and to create this umbrella organization, even with some rules that we can, my husband is a lawyer, he has already worked on some rules, but, by the way, it's something that it's a draft. So it's a working guidelines that we can work together in order to create something solid that can support us, in order to increase the international collaboration, best practice sharing, research, and why not, Karen, the fundraising, across boundaries. That's, it's something that everybody appreciate a lot. So I think that also in Montreal, it could be the right place to discuss it.
Yes, absolutely. We want this link to be strong and to continue. The reason why we started with IKDS.org is to become a host, a hub. So people just remember these 4 letters, IKDS, which is also the name of the meeting. And throughout the years, it will be maintained and sustained, and it will grow. So it's a link. We always needed that link. If we go back to past meetings, every meeting has its own website, and then we have to search for it. We try also to put some historical information from past meetings, but also we have web pages for family organizations. So in IKDS.org, there's a tab where you can see where are the other organizations, if they have an email, if they have a website, if they have a statement. So it has to be a hub, one book with different chapters to people refer to. I wouldn't call it the Bible of IKDS, at least a reference for IKDS. Also, we plan to continue communicating between collaborators, between people, whether scientists or families. So between 2 meetings, we should not see this silence of side communication, but hopefully we'll end up in this meeting with some homeworks to work on harmonizing guidelines, to work on how to put family societies together, how to engage adult cardiology interventionists in the future. We have to be advocates, not just among each other, but we need to write scientific papers that don't only deal with numbers, how many kids and how many complications, but also what are the needs of the disease as a community in terms of working together. Where are the problems that are not met in different regions of the countries? What are the specific needs in some countries versus other countries? So it is more comprehensive than just a scientific paper. So we need to be advocates and write these advocacy papers.
And I just put in the link that if anyone, if you do nothing else and you go to ikds.org and something's missing, your group is not there. The guidelines and statement that you use in your home country isn't listed there. We have things in multiple languages. Then please just email us and let us know. I can give you an example of advocacy is important in a different way in different countries. In the US, for example, how our patients and parents advocate affects our funding for research. And so that there may be something for your own home country that can really help improve. So we appreciate all and any efforts, and we welcome them all.
Great, thank you so much. I think that that's very empowering, that for us to feel that that's what we're moving to, because I think a lot of people feel exactly the way Rosella was saying, that we're doing all these things in our little silos, but obviously together we can achieve so much more. And you know, sharing knowledge and strategies that we have in our country, like you said, may be helpful other places, but maybe not. But maybe we can work together to figure out which things can be applied in those other countries. So I guess I'm going to move on to the Q&A section. So I did receive 2 emails specifically for this. So I'm going to start with those. The first one is very well worded and very a little bit complicated. So I think I'm sure that Dr. Tremoulet and Dr. Dahdah will be able to address it, but I think I will start the beginning to just put some context around the question. So the person has written that they have an 8-month-old who developed KD at 3 months and was complicated with giant coronary artery aneurysms. And they want to understand more about the role or persistence of IL-1 signaling beyond the acute phase of the disease. So they know that IL-1 antagonists such as anakinra have been anecdotally effective at preventing and even reversing coronary artery aneurysms in KD patients, and that this treatment option is being explored in the acute phase of KD. So their question is, if a patient continues to have coronary artery aneurysms, will IL-1 signaling resume after stopping treatment with an IL-1 antagonist? So I guess they're saying, in other words, could there be a potential benefit of remaining on a treatment with an IL-1 antagonist until resolution of coronary artery aneurysms? And is there a risk that the inflammatory pathway will restart and aneurysm regression will stagnate when the IL-1 antagonist is stopped? So this makes sense to me. I understand what they're asking. I don't know if Dr. Tremoulet, if you're going to answer this, if you want to provide some background for other people that may not understand the question, or if you want to just dive right in with the answer, I'm okay either way.
Well, I'll just say I've had the privilege to speak to this family. I think I know who this is, and they're a wonderful, caring, very passionate and advocacy-driven KD family, which we're blessed to have. I'm sorry for what they're going through. But I think their question is really important, and everybody hear me okay? And we're not quite as advanced as the question is, I guess is what I would say. So we've sort of considered Kawasaki disease to be an acute self-limited illness. It's the first sentence of every paper that's ever been written about KD. We know it's self-limited, meaning that the body sort of heals itself. But the question is, how long does that take? And is that different from patient to patient? And the answer is, we don't know how long it takes, and it probably is different from patient to patient. And it may be that in cases like this family, where they have giant aneurysms, the inflammatory process is much longer than what we expect it to be. My short answer, as I've shared with this family, is that right now that a lot of this is under study, right? So different groups, including our own here in San Diego, we're doing work on cell-free RNA, and basically just everyone's got their fancy way of looking at markers in the blood to understand ongoing inflammation. And I think what's becoming evident is that there's ongoing inflammation in the body, as well as at the level of the heart. And I think that that's sort of a big piece of the conversation at IKDS, to really be able to question this long-term use. So as one example, atorvastatin, which is a medicine that's used for lowering cholesterol, one of the statins, it turns out it also reduces inflammation. And so one of the new things that people are moving to with kids that are 2 and above with giant aneurysms is to have them on long-term therapy with the atorvastatin to reduce as an anti-inflammatory, nothing to do with cholesterol. So I think this is a really important piece that the science is just catching up with what the families already know.
Yeah, I agree with that. I think this is a very important question because it raises a subject that is of great importance: how to control the healing process and not just the inflammation, the acute inflammation. Part of the works that I've observed and read about and tried to work on is the myofibroblastic proliferation after the acute injury, that is re-endothelization after the coronary vessels have lost their natural tissue. They try to heal themselves with deposits of neoendothelial cells, but also with excessive calcium, excessive fibrin, not so much with cholesterol plaques, but again, coronary arteries could be target to cholesterol. So statins could be also, as mentioned by Dr. Tremoulet, a way to control the chronic inflammation within the coronary arteries. But also everolimus, sirolimus, these are components that are used to suppress myofibroblastic proliferation or excessive proliferation. At least in the adults, whenever they receive a stent in the coronary artery, these stents nowadays for the last 1 or 2 decades are covered with medications such as sirolimus, and these are medications will suppress endothelial hyperproliferation and restenosis. So the thing is that we have to acknowledge that Kawasaki disease and the coronary artery problems are a minuscule portion of the market. We have to say market because pharma doesn't work just for the sake of healing. Yeah, they work towards the healing, but they need to make profits so they can make new discoveries, they can make new research and produce new products for the healing of future problems or concurrent problems to which we don't have any cures or any remedies. So they work for profit and they really rely on the market share and profitability. So we have to keep this in mind. Having said that, so it's a minuscule part of the market in terms of disease, coronary artery disease, and therefore we somehow copy paste what is being discovered in adult cardiology, but this is not enough because we know that Kawasaki disease and the coronary arteries related to this disease are not the exact same disease with adult coronary arteries.
That I'm glad that you mentioned that because that's another question this family had, was how to promote this endothelial recovery and prevent calcification and stenosis. So what I'm gathering from your response is that right now the use of statins is one thing, but is there anything else that families can do to try and prevent these things? Because I mean that's the same battle that I feel with my son, right? He's been through that. He's had stenosis. He's had a stent put in because of it. So I guess families are sometimes looking for, is there anything else we can do? And the answer might be no, that you don't know, right? Or you don't know. But so I guess that's my question. Is there anything outside of talking to their cardiologist about a statin that they can do to try to prevent this type of stenosis and the calcification?
Yeah, I think that that's the first move, but that is also mostly in families 2 and above, or with children that are 2 and above, which is not the case for this family as I've spoken with them. And I think, unfortunately, we're limited at the moment on what we know. You know, as you read off my bio, one of the things I'm passionate about is pediatric pharmacology, and it's because most of the drugs that we use as pediatricians have really never been tested in the settings that we use them. But that doesn't stop us, because then we would be, barely using ampicillin. So, I think this gets back to the advocacy piece, where these kinds of questions really motivate us in what we're doing. And I think the question is to figure out, these are all based on pathways. So where's the science in KD? That's how we sort of come up with these treatments. What does the science tell us and where to look? And then how do we start to make requests in the US of the Food and Drug Administration, for example, to start studying these drugs younger and younger? So for statins, we got down to age 2, then we got some permission to do down to age 1, but not younger than that. And so it is complex, but maybe someone out there works with the FDA and wants to help us in this avenue. And that's where I think that piece comes in. It is limited, though, for the younger kids, I have to say right now.
Okay, thank you for that response. So I'll go on to the next question that I received by email. And just a reminder to anyone else that's in the webinar, please put your questions in the chat or raise your hand, and then we can know who wants to ask a question. So the second question I received was from someone whose child was diagnosed at 2 years old. And she's saying that it was ultimately started off with him being at the end of a viral illness, and then he received his scheduled vaccination for his age. So she's asking if there is a link between illness, like a weakened immune system, and the vaccine given at the same time that could have triggered his Kawasaki disease.
I think, in short, if vaccines would trigger Kawasaki disease, would have seen this much more common than we do. It will be extremely difficult to confirm this, and as well as to exclude it entirely from the chapter of questions on Kawasaki disease. Still, we have to consider that vaccines have saved millions of lives of children and adults worldwide. We should not take this lightly. There are definitely contraindications for some specific pediatricians for those matters. But if we learn from history, really vaccines overall saves millions of lives in different aspects. But I would have to add to the previous question quickly that we advocate healthy lifestyle, reducing obesity, controlling decent and good diet, encouraging exercise, especially in those with giant aneurysms. Exercise has to be controlled for sure, but we don't want to overprotect our kids and avoid them from engaging in aerobic exercises. Certainly, we talk about cigarette smoking and related nicotine consumption as well. So healthy lifestyle is important to everyone, even more particularly to these patients.
Great, thank you, Dr. Dahdah. The second part that she asked is actually kind of around a theme that I hear a lot from other patients. So her second question is, I see overwhelming amounts of KD survivors sharing their stories through a survivor group. Many have chronic and long-lasting ailments or diseases or heart issues in their adult years with very little issues in their adolescent years. This is what she's reading. Is KD something that lays dormant during adolescence after the first initial reaction, only to display serious conditions during the adult years? But before I let you answer that, I'll just go on to say that that's one facet of it, but other people I know also ask about ongoing things that have happened right after KD. So the dormancy part is one thing, you can address that, but my second part of her question would be more around, are there other long-lasting things that have a correlation to Kawasaki disease that we know of?
Yeah, so this is a really important question, and was the motivation for a young adult study that we launched about a decade ago at UC San Diego. I think, Karen, you're going to show the link at the end for a quick plug, but basically, we're fortunate our kids are growing up, but what they're facing are issues with the rest of their life, the rest of their health. And the question that every parent and every patient has is, what does this mean for my future, and how does it affect my health in the future? So far, what we've seen from the data of patients that we have followed either that have come to us from other parts of the world that we never saw initially, or the ones that we followed since they had their KD. We have seen that there is some issues with like atopic dermatitis, so rashes, eczema, psoriasis, things of that nature. There's a very, very small percentage of children that may have some more prolonged arthritis that happens. But in general, they're not, there's not a lot of information out there or a lot to substantiate there being any link with any other major illnesses. Although the caveat I'll put on that with everything in science is that it depends on how many people you've evaluated. So that's part of the motivation to have you share the link at the end and people to have the QR code for our young adult study, because we need more people enrolled. The more that we have in the denominator, the more we will learn. But there hasn't been, thankfully, a major link between KD and any major long-term disorders, either things that go through young adulthood or things that even continue through their teenage years, for the most part. Yeah.
Okay, thank you for that, because I mean, I do get a lot of that. A lot of my child has ongoing joint pain. It's not just in the first year, like in the subacute phase. This is prolonged. And I mean, I understand the difference between causation and correlation. So I know that it could be, unfortunately, this child also just has something else. Whether it was caused by Kawasaki disease or not is what I'm assuming that's what you're trying to figure out with these types of studies.
Exactly.
So I guess, but I understand from the parents' perspective, you're looking for an answer, and oftentimes they're not finding one. Even I've been a rheumatologist. I've tried this, I've tried that. Nobody knows what's wrong with my child. So it always comes back to Kawasaki disease, because that's such a traumatic experience for parents that they do go back to that. So I understand. So I think as more studies are done, it will give those parents some clarity and something to look to, because I think they feel very helpless in voicing these things with doctors and being often said, no, it's not that. It's something else. And it could be true, but I guess not knowing is very difficult as a parent, because you just want to help your child. And sometimes you feel the best way to help them is to know the root cause. So I think that's why we get a lot of that. I mean, specifically people ask about arthritis, neurological issues. So I've had questions on that. I don't know, someone asked if there's cognitive or neurological effects of Kawasaki disease. The literature does not seem conclusive on this point. So I don't know if there's something you want to say about that. Like, again, is it the studies are limited, or are there studies on that you can?
Yeah, so we haven't seen any neurological links or developmental disorders due specifically to children with KD that is more common in KD patients than the general population, right? You have to have that control, that comparison. But I think that it's something that needs to continue to be evaluated and studied. It doesn't at all diminish your issue. I mean, this is what our families are dealing with. This is what all of our, we all deal with on a daily basis with health issues, and trying to understand if there's any link. And I think we just need to continue to study and have bigger numbers so that we really know, again, is there any association there or not?
Great, thank you. I was going to see if I should pick a question. We didn't really talk about specifically aneurysm patients, but I do have some questions around that. I know these are difficult to answer often because you don't have the patient's records. So maybe I'll pick one that's a little less complicated. Someone was asking that if there's any data on the long-term use of Coumadin and calcification issues. So Dr. Dahdah or Dr. Tremoulet, if you want to address that, that would be great.
Yeah, I missed the beginning of the question. Do you mind?
Sorry, they want to know if there's any long-term data on the long-term use of Coumadin and calcification issues. I mean, but you can also address, because someone asked if there are kids that are on DOACs and aspirin, if there's any side effects. So I guess these patients, I mean, as long as myself, because my son also takes a DOAC, they just want to know, is there any studies that know the long-term effects of these things on their long-term use? Because if they're using it from when they're 2 for the rest of their life, what do we know about the effects of that?
Yeah, first of all, when there is an indication for anticoagulation, we have to take it seriously, because the drawbacks of not using anticoagulation in giant and multiple aneurysm, we know where it leads. It leads to clottings in the coronary arteries, to infarction, to arrhythmia, to acute coronary artery problems, ischemia, I would have to say sudden death, or dilated cardiomyopathy secondary to the ischemia. So it's a serious thing whenever there is a clear indication of anticoagulants. Now, shifting from antivitamin K, coumadin, warfarin kind of therapy, to a new NOACs, DOACs, direct oral anticoagulants, there is a trend of using these medications. There are very few studies that support the use of these medications in children, mostly in general in children, but specifically for KD, there are few studies, a few data out there. But there is a trend to support the use of those. The drawback of these medications, obviously, are how can we revert it in case there is bleeding? So it's a different kind of problem that we deal with. And long-term in children has not been cleared yet. We don't know, after 30 years of NOACs, would there be any side effects due to that? So I would maintain that avoiding coagulation is life-saving. Continuing with these medications might potentially have side effects. I don't think that calcification itself is secondary to that, because we've seen calcification-heavy calcification, macroscopic calcification way before, or in series where children did not receive coumadin and the likes.
Okay, great. That's good information to know. And I know that it's ongoing, the studies with the DOACs, and I think a lot of parents are anxiously waiting that, because it seems to be a better, sorry, I shouldn't use the word better because I'm not a clinician, but it seems to me to have a lot of benefits that and less drawbacks than some of the other medications. So we're all waiting for that. Hopefully there's more. I know there was a study that was done. I'm hoping there's more that are happening now. Rosella, I see you have a question, but I'm gonna go to in the chat, there's a couple that I didn't notice till now. So I'm gonna go to that first and we'll come back. So I'll just read it. It says, my daughter was diagnosed 2 weeks ago with Kawasaki disease. She has not been ill before our diagnosis. Her first symptom was pain in her head, neck, which was swollen lymph nodes. So she's asking what generally triggers Kawasaki disease. And then she goes on to say, thankfully her echo was normal. We go tomorrow for a second one. At what point could potential damage be seen on her heart? And she says that her daughter got treated early and was received IVIG on day 5. So I guess there's two things there. One is what triggers Kawasaki disease, the $1 million question, or $1 billion question, as it were. And also, at what point could potential damage be seen on our heart?
Yeah. So whomever finds the cause will win the Nobel, as far as I can tell. There will be a whole session at IKDS about etiology and concerns. And I think there's a lot of discussion, a number of hypotheses, people working really hard. Our team included, with climate scientists around the world, trying to understand what the causes of KD. What the family describes here is what we call lymph node first Kawasaki disease, which is well described, and it presents with that lymph node in the neck swelling first, and can get confused with an infection, which it's not. So I'm really happy that this family got treated early, got diagnosed. They clearly were somewhere and met someone that knew about lymph node first KD, so that's excellent. In terms of the coronary artery changes, 80% of, closer to almost 90% of children will have, if they're going to have an issue, it's going to usually be by about day 8 to 10 of their echo. And so we generally say that by that initial first outpatient visit, you'll know what's going on. And so things happen pretty quickly in Kawasaki disease, which is why there's an urgency to diagnosis, there's an urgency to treatment, and the importance of proper follow-up in the outpatient setting as well. Nagib?
Yeah, so as we know, there are no definite etiologies for Kawasaki disease, not specific virus. We know that COVID-19 has led to similar disease called MIAC, hyperinflammatory syndrome, and there's probably some Kawasaki disease patients which were triggered by the virus, by COVID-19, and there's no way to sort those out completely, the one from the other, but we know that one disease has different trajectory than the other one. Having said that, there could be not just viruses that would lead to Kawasaki disease, and fortunately enough, it is not contagious. Fortunately enough, not all children who are exposed to the same virus or bacteria within a daycare, within school, will develop Kawasaki disease, that's for sure. Talking about the future of patients and families, we know that family members, where especially moms, but potentially siblings who have had Kawasaki disease are at higher risk to develop the disease themselves. This does not increase dramatically the risk, but it's certainly more than the general population where the disease has not been developed in the family.
Great, thank you. So the other question we got was to circle back to previous comments regarding KD being self-healing or self-limited, I think is what the term was. If a patient's inflammation has resolved, my son diagnosed 2.5 years ago this past December, but the giant aneurysm remains. We're at the 6-month mark now with no improvement. What should we expect for possibility of resolution, self-correction, or healing? Or likely complications to look out for and what timeline? So what I'm gathering is they're 6 months in, they want to know what's the possibility that these aneurysms are going to resolve, and if not, what they might expect to deal with in the future.
That's a back-breaking question, because we would love to be able to answer. We would love to have a cure to these acute aneurysms and to have them regressing as soon as possible to a limit where the risk of clots is no longer a big deal to worry about. So short answer, we don't know. We know that giant aneurysm will most likely persist. Sometimes they will reduce in size, especially in the first year or so. They will reduce in size. The smaller ones will probably go back to a normal size with limited risks for stenosis. But the giant aneurysm, now we can subdivide them in giant and supergiant based on the Z-score. So yes, the giant aneurysms require treatment to avoid clots and blood clots within the lumen of these coronary arteries. But they are the supergiant aneurysm that are actually at the highest risk of these long-term complications. So I think it is also a fairly recent information dividing, in our mindset at least, giant from supergiant. They require the same treatment, but the risk is higher as the size is relatively bigger.
And Karen, also the other part of that is sort of what symptoms to look out for, what to be aware of. I think it's very important for any of our families. For example, if your child is on an anticoagulant, they should have a medical bracelet, simple things like that. You know, our kids, once they get to be at school age, sometimes spend more time at school with their teachers than they do with us at home as parents. And sort of having a plan in place. We do a transition of care program here at UC San Diego where we educate starting at age 12 for any of our aneurysm patients to start to find out what they know about their disease. What do they know about symptoms? How can they tell if someone, you know, are they just having heartburn because they ate too many hot Cheetos, or are they having, you know, a more serious complication due to KD? And so those conversations are important to have with your provider early and often. I think it also helps the families to know, in case of an emergency, where would they go to? What is their closest hospital? Where would your child go to in an ambulance from their school? And is that local hospital familiar with Kawasaki disease? Or is it an adult-based hospital that would have less knowledge of what to do with a child with aneurysms? We provide our families with a summary, and every teenager carries around their cell phone. So we have our patients take a picture of their medical summary and carry it on their phone, because I promise you that if they go to the ER, they may not remember anything, but they'll have their phone with them, so they can share their data. So there's a lot that families can do to, to understand and to prepare themselves and to educate their kids. Our parents know a ton about KD, but I'm surprised every time I see a 15-year-old with aneurysms who doesn't really even understand why they're on an anticoagulant. It's frightening, frankly, as a parent myself. So those conversations need to start early and often, and get families prepared for that, for their kids growing up from that perspective too.
I would
Absolutely.
like to add a positive perspective to nowadays problems with giant aneurysms, is that, for one, you should not live in an anxiety mode day after day. Please relax. Things do not happen every day. They do not happen on around the corner. But yeah, they do happen. This is why education is important. But we hope that education will reduce the anxiety level of parents and of children. We also want everyone to know that KD experts and less experts are not left alone. In other words, we're talking about cardiologists and rheumatologists and pediatricians and all those experts. We are a network. So anytime I need information to back my opinion, I can go on and ask other colleagues of mine and so forth. So networking within KD experts and around the KD experts is really well built. It's really an open discussion, and it helps us also bring to you probably the best options and an educated option, because not every patient is similar to a textbook. Sometimes patients have to be considered a little bit differently.
Yes, I have found that in my own experience dealing with some of the things my son has gone through, and my cardiologist also had to reach out to other experts, including adult cardiologists, to figure some of that stuff out. I know we're getting close to time, so I'm going to quickly go with one of the questions, then Rosella, and then we will. So, because I just want to jump off, it's something that Dr. Tremoulet had said about educating during transition. The question that was in the chat was basically, I think, from what I'm understanding, I don't think that their child has aneurysms, but they just want to know how, like, for example, she was saying when her son goes to summer camp, that she needs to put that he has a history of Kawasaki disease, even though he doesn't have aneurysm, or at which point should this be brought up in his medical history?
And we get asked the verb usage. Does your child have Kawasaki disease, or did they have it before? I think there's certainly nothing wrong with transparency and informing of past diseases if your child hasn't had aneurysms. Our families have taken it as an opportunity a lot of times to, you'll put down Kawasaki disease and someone will say, "What's that?" And I promise you that by educating someone at school, for example, about what you put on a form, you'll help another family get diagnosed. Because on average, as I'm seeing here in the chat, what's being explained is common. It's an average of 3 medical visits before someone gets diagnosed with KD, usually around the globe, if not more. So yes, I think it's okay to share that, but I think it's also important to understand the risks, as Dr. Dahdah was explaining, and to have that conversation with your physician. The majority of the kids we treat, even the ones that have aneurysms, really have very few limitations in life, and we want to make sure that we're providing kids with that opportunity to grow up and to participate in camp and to participate in life fully. And so that those conversations are important to have.
Great, thank you. So Rosella, thank you for your patience. I'm going to let you ask your question, and then that'll be the last one.
Yeah,
and then we'll go
but thanks
yeah.
to you, and your availability to answer all these questions. My question was related to exactly to this, to the transition from pediatric, patients to young adult patients. If you can share some experience in this transition. In Italy, there is a recent law that, you know, that was fostered by the Rheumatologist Association of Doctors. And so it's not specifically for Kawasaki disease, but it can easily be applied to Kawasaki disease. So we are looking for best practice to do that. And as a mom, I cannot, you know, I have to agree 100% with what you have said. It's not easy for a teenager who had Kawasaki disease when he was, my son was five months old. So it doesn't remember. I think it's normal. So it's easy when you are a teenager to refuse from one side. Don't talk with the parents on this. You are used to medication, but you are not self-committed to this. So if you could share your experience with the transition would be more than welcome. And one comment I have on what you said, Dr. Dahdah, related to the pharmaceutical industry. It's 20 years that I work for pharma companies. So I know very well how profitability drivers work, and numbers are important because, you know, you make research, you make acquisition, you put funds where the numbers will give you money back. And that's the reason why I think that being together, not, you know, an international umbrella organization could also drive, why not, the decision of some pharma or medical device company, because I work specifically with stent medical device company for adult. There are no stent or coated stent, medicated stent, drug-coated stent for children because there are so few. So the size of the stent, of the cardiac stent, are for adults, not for children. But I think that if we put numbers and if we put also the benefit to, you know, to have an ethical reward, we can do something on this. So why not, you know, to aim to this goal as well. And then I shut up. Thank you, Karen, and both of you for your for your patience with me. Thank you.
Thanks, Rosella. No, that was well said. So I'm glad we waited, that you were waited to say that to us. I don't know if Dr. Tremoulet wants to, or Dr. I want to say further to what Rosella said. Otherwise, I'm going to put up the slide about the adult KD study. So Dr. Tremoulet, do you have something to say in response to Rosella, or shall I just?
Yeah, I think your points are all excellent. And I think it really calls for a process that is as unified as possible in educating our patients as they grow up about their disease. And I have teenagers myself. They are consider themselves invincible. And I don't want to break anybody's teenager's spirit, but it's okay to be able to explain and to ask your provider to sit down with your teenager. And what I do is I go through and I say, you know, you won't remember, but when you were 5 months old, let me pull out the initial sheet that I wrote about what happened 15 years ago and what you presented with. Here are pictures. Here's how you showed up. Here's a model of the heart and why we care, and to start to give them some ownership over their own health. But it's a complicated age, it's a complicated disease, and it's going to be an ongoing conversation on how to educate. And in regards to pharma, Rosella, hey, if they want to sponsor and come to IKDS, they're more than welcome to. Let us know. But yeah, let's not forget, this is the most common cause of acquired heart disease worldwide. And so collectively, I think we hold a lot of power to have that statement and stop calling it rare. Call a spade, call it what it is. And it's the most common cause of acquired heart disease. And I think together we can, together we have that strength. That's what I'm going to say in echoing what you just emojied. Yes.
Yeah, I would like to add, because I read here, we went to the ER, we went to see dogs 1, 2, 3 times. Finally, this astute ER had the finger on, which is great. It happens a lot. Also, best dogs used to be moms and aunts and uncles and grandmas. They used to figure out, well, this kid has rubella, whatever, and then the physician would confirm or infirm the diagnosis. So please talking about advocacy, it's not only parents with KD, it's also the neighbors, the uncles, the aunts, the cousins. So a Tupperware activity for Kawasaki disease would do great. Tupperware activity, you know what Tupperware activity been in the 60s, big hit. So talking about disease is important everywhere. So people know, well, I've heard about this and maybe my kid has it.
Great, thank you. Oh, thanks. I'm going to share the slide now, Dr. Tremoulet, for your adult.
Yeah, we just wanted to make sure. So a lot of us there's a ton of us doing research in this area. It's just one small effort to understand about Kawasaki disease. So this is a study that we've been doing. It says they're 18, but you actually have to be 15 or older to be part of the study. It's a survey that we do of our patients that have had KD, and we ask for them. We're also looking for controls. So even if you have a family member that hasn't had KD, that is a good control, that would be great. So again, it's just one small effort to start to answer all those important questions about the long-term implications of having had KD as a child. And we appreciate everyone's efforts in continuing the conversation. And we hope to see as many of you as we can in Montreal, but know that if we can't see you in person, your local KD parent group has a ton of stuff going on, and we appreciate everybody's help in educating the world about KD.
Great, thank you so much. And we will put the link to that, the email address in the with the YouTube video. And so I also have another study that I need to also share that's being done by Sick Kids Hospital in Toronto. And it actually goes in line with what we were talking about earlier about information, about how patients need to educate themselves about Kawasaki disease. They're actually doing a quality improvement initiative. So the purpose of their study is to provide unique experiences to survey parents to see where the gaps are in KD education. So for patients and family-centered resources and transition to adult care. But this is not just for aneurysm patients. This is for any Kawasaki disease patient. So I'm scrolling up. I don't have a fancy slide ready, but it also has the link and the QR code. So if you want to take a quick picture of it with your phone, you can follow the link. But again, we will put the links in the YouTube video, the description of the YouTube video. So anyone that doesn't have time to put it down now can visit the YouTube video, and we will also put it up on our website. So I think I'll talk to Vanessa, but we will put on both the KDF and the Kawasaki Canada websites. We'll put up all this information so that you can go there and get it if you weren't able to take it down now. But these are very important studies to really help future patients and current patients, hopefully, to have more information and how to get them the information. So I think it actually blends nicely, the two studies, while different, still address a lot of the same needs. So thank you so much, Dr. Tremoulet, Dr. Dahdah. We are so grateful that you took time out of your very busy schedules to join us today. I think it was a great discussion, and you shared some amazing information that I think the parents are very grateful for. And it's a great kind of teaser of what we can expect at IKDS. So I hope any parents, I shouldn't say parents, patients, families, caregivers, anyone that's interested in Kawasaki disease, please check out the link, ikds.org, and consider joining us, because we would love to see you and meet you. And even as the charities and the advocates, we love to hear your stories and learn from you, because this is a collaboration, as we said. So I encourage anyone if they're interested, to please join us. And if you have questions, you can also email us or reach out to either of our organizations, and we'll be happy to answer whatever we can to help you. So thank you so much, everyone. I appreciate your time.
Thank you, everybody.
Thank you for inviting us.
Yes.
Thank you.